welcome to Rodeo Surgical Art. Today I have the pleasure of taking care of Terika. We've gotten many requests to make these videos and make it more educational for patients' view. Today we're going to be using Juvederm gel, which is a HA filler that is used to improve the resting lines in the nasolabial fold. Nasolabial fold is commonly called the laugh line. Terika has always been concerned about these laugh lines. What bothered you about this area, Terika?
They just feel like they've gotten a little bit deeper as I've aged.
Okay, there are various type of fillers that can be used. Juvederm is a very versatile material. It lasts up to 2 years. There are two different kinds. We have the Ultra, we have the Ultra Plus. The Ultra Plus is the thicker version, it lasts up to 12 months. We're also going to be utilizing what's called the cannula technique, which is rather than using a needle, we use a needle-like structure, and the characteristics of the injection is very, very different than using a needle. It has to be an advanced injector who's using it. Less chance of bruising, swelling, intravascular injections. We'll show you our armamentarium, therefore you can be really get educated and comfortable with your treatment. Okay, Terika is already been numbed with some topical anesthesia, also used a very unique technique of local anesthesia. She already received it. That's why when you may see it or may not see it in the video, but the numbing cream causes what's called a little bit of blanching. Blanching is the skin becomes a little pale looking, and that stays on for a couple of hours. Okay, Sandra, who's helping me with the video, is going to show you my armamentarium. Extremely simple. This is my topical anesthesia. We have some bacitracin ointment that I may use for massaging the area, some 2x2 alcohol for preparation. This is the Dermosculpt cannula. It's packaged very nicely. This is the cannula. As you can see, it is not sharp, is rounded. This is the Juvederm Ultra Plus XC. The XC stands for having numbing medication mixed with the material. The boxes usually come in 2. You could use 1 or 2 depending on your patient selection and the amount that patient may need. So this is your Juvederm. It's a jelly gelatin-like material. It's a HA material that's also found in the intracellular, which means you can find this material in your cell and your skin. Making sure the area is very nice and clean is extremely important, because you don't want to introduce any bacteria or anything like that into the area. So we're just gonna have Terika turn this way. You may feel a small pinch, you may not. Okay. Does that bother you?
No.
Okay. So this is your entry level or entry port. So you place a needle. I'm gonna have you chin up a little bit. So now the cannula goes through the entry point at where you made the needle entry. Bring your chin down a little bit. Obviously, as the head position changes, the laugh line changes, so it's very important that you keep the patient in their natural level and do inspection about how your injection is proceeding. Terika, you nice and comfortable? Okay, so this was the little bit of the deeper side. A little bit this way, sorry about that. Okay. A little bit of more depth here, so we're going to put a couple of drops in there. Alright, so we're already done with one side. And gonna wipe the area, make sure that the filler is setting in nice and comfortably, and there's no irregularities or bumpiness. Alright, so you can go ahead and take a look.
Wow. That looks great.
You can achieve a little bit more drastic result if you use more, but I think Terika really wanted to stay conservative. If you overfill it, sometimes it's more natural to still keep a little bit of a line in the area. Okay.
Like
You see the difference? You like
yes.
it? Okay.
Very natural, but less deep.
Okay. Alright, now we're gonna go ahead and go to the other side. Called the stacking technique, which we stack up the material on top of each other. So have a few drops. I want to put it a little bit on this side, because this side is still a little bit deeper. Skin almost heals very quickly right after that. Sorry about that. So now what I usually do is right after the injection, I have the patient sit up in a seating position because when the patient is laying back still, your anatomy may be slightly modified. This way I'll make sure that the result is satisfactory by the patient. So if you don't mind, Terika, I'm going to have you sit up.
Okay.
And go ahead and take a look, make sure you're happy with your result.
Yes. Yay! That's perfect. That's natural.
Okay, so
I like it.
actually when the material sets in about a week or two, although the results are instantaneous, in about a week or two, the results are actually maybe even better, as we call it, the material is settling in. Okay. Pleasure taking care of you. If you have any question or concern, please feel free to visit our website or call our friendly staff. You can visit our website at Rodeo Surgical Art, or you may call us at 310-652-4500. Thank you for visiting.